Local stories, local people. We're taking you inside Western Mass news. It's the Even Better Western Mass podcast with Dave Madsen.
Welcome to this week's edition of the Even Better Western Mass podcast. Wherever you are, I do hope you're doing well. A happy Mother's Day to all you moms and grandmothers out there. Hope your Mother's Day Sunday was a good one. Good to see all of these venues that were closed Mother's Day last year having moms and their families back this year for dinner or for brunch or whatever it was. We're slowly but surely getting back to normal. That is a good sign. Most of the kids are back to school, high schoolers going back either this week or next week. So at least for the last month of the school year, things will be relatively normal, and that's a good thing to see. Well, this week we focus the Even Better Western Mass podcast on the Alzheimer's Association. Its goal is a world without Alzheimer's and all other forms of dementia. Formed in 1980, the Alzheimer's Association is the leading voluntary health organization in Alzheimer's care, support, and research. A number of guests this week. As a matter of fact, more guests than we've ever had on the podcast. Beth Cardillo is the executive director of Armbrook Village in Westfield. Grace Hanson is the senior living counselor at Keystone Commons in Ludlow. Aimei Lund is the association's manager of The Longest Day, and Jacy is the manager of the Pioneer Valley Walk to End Alzheimer's. We talk about the association's mission and their work here in Western Mass, and about events coming up where you can help in the fight against Alzheimer's. I want to thank you all for being here and being part of Even Better Western Mass. Beth, you have been on the program before talking about Armbrook Village. Beth Cardillo is here, Grace Barone, Aimei Lund, and Jacy Settles. We are going to talk about the Alzheimer's Association. And Jacy, I think let's start with you. And I think really before we move along too far, we need to talk about the association, what it is, who it helps, and the mission.
It sounds great. Thanks again for having us, Dave. The Alzheimer's Association is the leading voluntary health organization for Alzheimer's care, support, and research. It's our vision to live in a world that's dementia and Alzheimer's free. And for us, we do that through care, support, research, and advocacy. So we're helping any of those families that are being impacted, friends, and those that are involved with Alzheimer's altogether. So it's one of those things that's very mission driven and volunteer led by all means. And for us, to give the staggering numbers of this and why we do what we do, there's literally over 6 million people living with Alzheimer's right now. 1 in 3 seniors dies of Alzheimer's or dementia. So, and put that in perspective a little bit, it's really, you combine, it's more than prostate cancer and breast cancer combined. So really, a lot of times, trying to portray that to someone, when you put that together with, combined aspect of it, that's a lot. And I believe right now there's literally in Massachusetts alone is 130,000 people that are actually living with Alzheimer's or dementia right this second. So the scope and impact of what we do as far as care, support, and research and all of our programs, it's nonstop. It's very useful and helps all families, including mine, and as well. So it's we're here very proud to be a part of the association, and as you can see here, very proud to be working with these wonderful women.
It's one of those things is I'm in my senior years. I'll be 70 in a couple of months. As a senior, it's one of those things that I think it's a fear that all seniors have, more than anything else. And I know it just doesn't affect seniors. It can happen at an early age to many people. Let's talk about some of the programs and services that you offer here in Western Massachusetts, because, I think more than anything else, there's power in knowledge. And I'm guessing that's part of what the Alzheimer's Association does.
Who do you want to take that?
Anyone, because I know you all know a lot about it.
So I'll mention a couple of things, then I can have Jacy probably talk more. But one of the things that we do here is, and for Western Mass and probably throughout the entire state, is provide support groups for people. And there are many different, whether it's assisted living facilities, nursing homes, whomever that wants to start a support group. I know for myself, I've went through an Alzheimer's Association support group training. So I am a designated facilitator for the Alzheimer's Association. I've been doing a support group. Geez, Grace, I used to do it at your place for 5 years and then 9 years at Armbrook. So for about 14 years, I've been doing a support group. It's the last Wednesday of the month. And right now it's in the comfort of anybody's living room. I facilitated on the last Wednesday at 6 o'clock in the evening, which goes to about 7:30. And it's for any caregiver, whether your family member is living at a facility, a nursing home, assisted living, or whether you're caring for that individual at home. People all need support. It is nothing better than 10 people sitting there talking and saying, oh my God, I didn't know that. Thank you. How did you get through this? What happened to your family? Do you have any resources available? Give me the name of a neuropsychologist, whatever it is that you're looking for. And I think people, at least at the group that I've been doing for 9 years, they've all become best friends. They do things together. I mean, they've really became not just a support to each other once a month, but they're a support to each other daily. And I think that's really what the purpose of those support groups are.
I can imagine the importance of those support groups because while the person who's dealing with Alzheimer's is one element of it, the caregivers are the ones who really have to understand this the most.
Right. And there's a lot of people just don't know because you don't know, things that we know being professionals. When you say to your mother who's got dementia, Ma, you've told me that 25 times already, that really doesn't help because they don't remember that they did that 25 times and they don't know how to stop that. So working with families so they can understand how to lessen their own frustration and how to make a better relationship with the person that does have dementia, right? Otherwise it's a no-win situation and you want it to be a win-win situation. So there are a lot of tips that I think we help people with, but mostly they all help each other.
Yeah, understandable. Aimei or Grace, as we talk about the support services, I guess the power of education and helping people live with Alzheimer's and the caregivers more than anything else, as we mentioned.
I think
yeah, I was just going to add that it's definitely all of our programs and services are 100% free to the community. And I think that's a great part of what the work that the Alzheimer's Association is doing is that everyone can get the support that they need from us free of charge. And I think that is super important to know, but we definitely have a lot of education programs for people who are in the field as well as caregiving, whether that's learning about the warning signs of Alzheimer's, understanding the disease. And specifically right now, we have a COVID-19 and caregiving educational program to really help people who are caregiving during this pandemic, because we know that has created just so many challenges on top of what everyone is already experiencing during this time.
As well as also the legal and financial planning, right, with elder care lawyers to understand it better. And the other thing I know is a consultation program, right, where if you need help, somebody who's a clinician will talk with you. And there's also a 24/7 helpline that you can call anytime to get information, or if you're in kind of a crisis mode. There is so much out there. But the other big thing, I think, is that all the money that gets raised through the walk and other things really gets used for keeping the offices alive, keep people, Jacy's job and Amy's job, so they can help others. But also, it also goes into research. And I can't even tell you the amount of money that is put out. I went to one of the conferences in Boston a few years ago, and they had all the top research folks, and I can't even tell you the names of the types of things they were researching, but all for medication for Alzheimer's. And they were researching this protein and that protein and what it does to a specific part of the brain. It was incredibly clinical and way above my reach. But there's millions of dollars being spent on research. And I think so much of the money that gets raised from the Alzheimer's work throughout the country goes into these research grants with these molecular biological scientists. And it's pretty impressive.
Grace, when you look, folks are wondering, you get to a certain point in time in your age and everything, well, you can't find your keys, or you don't know where you did this, or you don't know who did that. And this fear that, oh my God, that's onset Alzheimer's. What would be some of the signs that someone should look for?
Well, I had an opportunity to listen to a seminar that was presented by Dr. Madsen. As a female, 2/3 of those with Alzheimer's are women, and approaching my 60s. It's like, oh my gosh, I come in the morning, I swear I put my keys down, and then the next day they're not there. Do I have Alzheimer's? Is this the beginning of? So that's where your mind goes, because you work in this and you hear about it often, and there is that concern. But as he said, it's not so much that you get up the next day and the keys aren't where you left them. It's when you find the keys in the refrigerator, or an item is somewhere that just doesn't make sense. That's a cause for alarm, because we're all so busy and we're constantly multitasking, and we're trying to do this and do that. So you come in and you think you put your keys down, but you didn't, because you're thinking about, I got to make dinner or whatever. But when those keys turn up in the refrigerator, that makes no sense. When you find yourself somewhere and you don't know how you got there, how is it that I am here? Things like that are discerning. And that's when I think you need to start talking to your primary care and be very honest. I'm worried. This is what happened the other day. I found myself somewhere and I didn't know how I got there. I couldn't even remember what level I was on with my car, or how I got to that particular place. Those are red flags, and definitely start a conversation.
Yeah. Aimei, you touched on COVID-19, and Beth, I know you and I in our earlier conversation talked about the impact of COVID-19, and more than anything else. And I think what really brought it to light for me was when we heard about Tony Bennett. And they said as long as he was out performing and was able to keep singing, he was fine. But the isolation of COVID-19 has really had an impact on his Alzheimer's, and how many people this has affected that way. I guess so many impacts from COVID-19. Let's talk about that a little bit.
Yeah, I'll definitely just start with saying that unfortunately, due to COVID-19, Alzheimer's and dementia deaths have increased by 16% this year nationwide. So whether that's from decline that would have happened, but also we just, as you said, we've seen a lot of the impacts of the isolation of being apart, and understandably that was for safety, but it also in turn had a lot of negative effects for so many. And in Massachusetts specifically, we had 524 more deaths than expected due to COVID-19, which was 7.1% higher than the national average. So it's definitely something that is impacting our community extensively, and it's something that the association cares deeply about. But I know, Beth, you can talk a little more about what you've seen as well, because I know that you are seeing it in a different light than I am.
Beth, what struck me was you spoke to me about this gentleman who had always gone to dinner with folks, and when what happened to him when he had to be by himself?
Right. He started, we didn't realize it, but that he was more impaired than we thought. And he kind of forgot how to eat. And he started losing weight. We went up to his apartment and we happened to catch him at dinner time. This is when meals were being delivered, and he was throwing his entire meals down the toilet. So he wasn't eating. And we think he really kind of forgot the ABCs of eating. And we ended up having a special group in our dining room every day with him and a few other people. So he was able to model the mechanics of how to eat by watching other people. I mean, who would have ever thought? We probably wouldn't have caught that, right? So you don't know what you get from other people.
We took away their socialization.
Right.
Habits and routines were turned upside down for our seniors. The senior center isn't there for them anymore. Sunday services, so many people kind of gauged what day of the week it was by, oh, I went to church on Sunday, so that's Monday, and then this is what happens, because they had groups they met with, and all of that came to a screeching halt. And the ability to just communicate with others and being social, we've known that isolation isn't good. And then that was just imposed, and our seniors suffered greatly for it. And as we come out of this COVID fog, I think the numbers will continue to rise.
And that was cognitive isolation, but there was also the physical isolation that people weren't getting out. They weren't walking. They weren't, I mean, just physically they deteriorated. There was an increase in falls because they weren't working on balance and walking. We know exercise is the best thing you can do. And they weren't getting any of that either. It was such a recipe for disaster.
You know, those are the things that, you know, each and every day we hear of the deaths from COVID and that impact of it. So, I mean, when you stop to think about it, that the far-ranging repercussions from COVID, we probably even haven't scratched the surface and don't know what's going to, you know, once this all settles down, what we're going to see.
Yeah, that's the big if, because nobody knows, right? You only have as much data as you have when COVID came out. So you have a year of data, right? Which isn't enough to really tell us anything. The same thing with the vaccinations. You've only got a few months of data. So I guess time will tell on some of that. We're seeing, I don't know about you, Grace, we're still seeing a lot of, we've had more people that have aged in place quicker, right? Because of COVID. We've definitely seen a higher rate of deaths in this last year, not because people had COVID, because they went through the isolation and it just took a beating on them. And every assisted living right now throughout the country is going through that. Their occupancy is definitely taking a hit.
Grace, you're seeing the same thing, I assume?
Seeing the same thing. Same thing. And we here at Keystone recently expanded our memory care from a traditional, which we still have, and now we've got a level 1 memory care, and that filled in record time. I just think, again, as we continue to come out of this, the need for all of the programs that the Alzheimer's Association puts out there, and housing, I hope we're prepared for it, because I just, we used to say there was this big tsunami coming, and it feels like it's headed our way again. And we need to prepare for it.
Well, that brings us to the importance of fundraising. And I'm sure because of COVID-19, a lot of the events that you normally have, I know like many agencies, you may do and done virtual walks and things like that. But fundraising has also taken a hit because of COVID-19. So, you know, as we tape this, the state is opening up a little bit more. And one of the things they talked about was the ability to have walks and to have races and things like that. So let's talk about the importance of fundraising. And I know, Aimei, one of the things that's coming up we're talking about is the longest day.
Yeah, I'm the manager of the longest day. It's something that really excites me, but we're definitely really excited to have our walks be able to most likely be in person this year, obviously with the safety of everyone at mind first. But like you said, fundraising is definitely important to the Alzheimer's Association. It helps us fund all of these programs and services that we are able to offer our communities completely free. And it's because of our incredible volunteers and our incredible participants that we're able to do this. So we are so thankful. And even though we have seen a hit this year because of COVID, we are in a much better place than I think most of us anticipated because of all of the incredible work that everyone's done. So I know I can speak for me and Jacy and the rest of our staff that we are just so incredibly thankful for everyone. But the longest day is definitely a great event. It's centered around the summer solstice, which is June 20th this year, the day with the most light. And it's really a metaphor for the longest day. The longest day for people living with Alzheimer's, for their caregivers, sometimes every day can just feel like the longest day of the year. So we really want to give this day and kind of give it back to those who can then honor their loved ones by hosting a fundraising event, by thanking donors that day, by recognizing and thanking caregivers, by bringing awareness to the association. So we're really trying to take that day back and just give it a lot of meaning within the month of June. And the longest day, in a nutshell, is a do-it-yourself fundraising event. It's one of our signature fundraising events of the association alongside Walk. And it's a great tool, especially this year in the pandemic, because you get to pick any activity that you want to do, plan it on any date that works for you, because we know the summer solstice might not work for everyone. This year it is Father's Day, so it might be a great day if someone wants to honor their loved one, a participant who is planning it for Father's Day to honor their father that they lost. But it also might not work. You might be busy. So you can do it any day of the year that works for you. We ask that you invite family, friends, coworkers, neighbors to support you, and then just raise as much funding and awareness as you can. But it's a great option because you can really do anything that works for you. We see people running, biking, selling hot dogs, playing cards, doing yoga classes. So it's a great option that you can do physically distant from each other, or you can do it in small groups. Pre-COVID times, we've had huge fishing tournaments, we've had huge kayaking events. So it's a great way that you can just tailor it to do something you love, to honor someone you love. And it's a great event. I definitely hope to see people join us this year in June and all summer long. If you want more information, people can go to alz.org/thelongest.
Jacy, let's talk about that walk because, like it or not, September will be here before we know it. I know things were a little bit different last September. As we look to September 26th this year, let's talk about that and where things stand and where you hope you'll be in September.
I think we'll be in person on September 26th. And we'll also have the option to walk as everywhere, meaning that for the safety is paramount for our walkers, our staff, and anyone that's involved. So you'll still have the option to walk in your neighborhood or go on a hike. Beth does a lot of kayaking, so you can be doing something along that lines to still be involved. But we are planning to be in person. And for us, Walk is our largest fundraiser and campaign awareness for the Alzheimer's Association. So for us, again, just as Aimei mentioned, this is all for our no-cost programs and services in which what we provide and whatnot. So essentially, this allows us to do that. So it's exciting to be a part of that. The walk in itself is all volunteer-led, like everything else. Our planning committee for the Pioneer Valley Walk is volunteer-led. Beth is our sponsorship chair. Grace is our marketing chair. So essentially, it's those everyday folks that put this together. I do want to, before I forget, say thanks to all of our walkers and anyone who's helped us along the way, because it is without a doubt for them and by them, and it's one of those things that is inspiring. So for me, I'd really like to make a pitch to everyone who is listening or seeing this, is to just sign up for a team. Register your team. It's free. It's completely free. It's a great way and easy way to spread awareness about what we do. But the one thing I would say is walk is symbolic. It's really something to be there in person and to have the camaraderie and being able to relate to everyone there on that walk day. It's something special. Obviously, it's one thing to see in videos in the virtual times, but now that we can congregate, hopefully come this fall, we'll all be there in person to do so. So for me, it's really exciting to be a part of this. But for those who are interested in being involved, by all means, we can share my contact information if you want to be on the walk committee or just volunteer as on site. We're always looking for help. It is volunteer led, and hopefully one day we'll find that white flower soon because of the walk.
Boy, you can only hope. And I suppose one of the other things with the walk too is that, day to day, folks who are the caregivers dealing with the loved ones who have Alzheimer's, you feel pretty much alone. But what I saw in the walk was all of a sudden on this one day, everybody's together and you realize you're not alone.
I think that's a big thing. And even then, I know Beth and Grace could probably speak a little bit more on the camaraderie and being able to, you're not alone. But the one thing I can say too, and I don't ever try to bring my family into this, but I am a terribly proud person for working at the Alzheimer's Association. As my dad is the caregiver of my mom. My mom does not know me anymore. He's a 78-year-old caregiver, but being able to share the information about Walk, to share our programs and services to them, I finally have been able to open that door. So again, I think it's one of those things to be able to feel that you're not alone. Even for me in recent times, that's happened personally. So I can imagine when you're with hundreds, thousands of other walkers and you're there together, I can only imagine the feeling that you can have. So I mean, obviously I know Beth and Grace have been this majority of time, but I'd love to hear their feedback as well.
Well, I think there's nothing more than we'd all love is to go to an Alzheimer's walk and have nobody be there because there was no Alzheimer's, right? Like, let's celebrate the first survivor. We hope that happens, right? We know there are some new drugs that are out there on the forefront now. And, I can never figure out how they got a man on the moon, but we can't seem to find the right medication for Alzheimer's. And the last probably 20, 30 years, they get to clinical trials and then it just doesn't make it to the next step. So maybe this new one will be the one that works. Who knows? But you're right, Dave, there's nothing more exciting than going to this walk and seeing thousands of people dressed in purple shirts, with their kids, with their dogs, with their parents, people with walkers, carriages, whatever, just walking en masse at Holyoke Community College and just seeing all those people walking together. And definitely you are not alone. So that really is a beautiful thing to see. One of the things that we're always looking for are sponsors.
Mhm.
So we certainly want teams, but we also want people registered to be a sponsor. And right now, I think we're about halfway through our sponsorship goal. It used to be a heck of a lot higher, but given the year that we've had, it's been lower a little bit this year. And so we have a lot of, it's $1,000 for basic sponsorship. We have a lot of people that if it's in person, all of us that are sponsors bring all of our information with us and set up tables under a tent for all the walkers to take a look at. And we usually get all the assisted living facilities. We get most of the nursing homes. We get some of the adult day programs. We get places like Bay State Medical Center, the behavior dementia. Oh, God, look at me. I can't come up with the right word. The dementia clinic, memory disorders clinic. But we know that everybody knows someone that has dementia. Everyone has a friend who has a family member. It's that prevalent right now. And so, I mean, that's really how you raise money, right? I think Jacy just got an amount from People's Bank as one of the sponsors. And probably they know someone that has Alzheimer's and that's why they're giving. So this is a plea out there for anybody who's listening, whether you're a banker, you're the manager at McDonald's, whatever you do, if you have any extra money to give out, we'd be happy to take it and have you be represented at the walk. And if 1,000's too much, give us anything. We'll still have your name out there, but we really do need to raise that money because it really goes to what's needed. It goes to what's needed in Western Mass, and it goes to what's needed in research.
Well, the fact is no one's immune from this. I mean, at any time, anyone in any of our families could be impacted by this. And, the fact that we think we can skate through life without these things happening to us is kind of silly. And because it is, I mean, you just, you don't want it to happen, but the realization is it could to anyone.
It can happen to anyone, impacts everyone's life. And we think that it's just something that happens to older folks, but those older folks have grandchildren and it's affecting them and it motivates them. And I'll let you talk about this afterwards, the young man in Long Meadow who's amazing, but it impacts everyone's lives. And that's something I hope that our employers in Western Mass, we always come together here as a community and we do a great job. And I hope to see more of our employers in the Western Mass Pioneer Valley come together, because this impacts your employees. It affects their quality that they can bring forward. And these programs that the Alzheimer's Association puts out to help them cope with what they're going through, we need those. And as an employer, if you can't sponsor, if you can just put a group together, support the team, have people rally for that particular employee, and you start a team, you all wear purple. That means so much to everyone. It lets you know that they care. They're here to support me, and I'm not going through this alone, which sometimes it can feel really dark and that you are in this all by yourself. Yeah. And that's why that sea of purple when we walk is so important. But it's also important for all of our employers in the Western Mass Pioneer Valley to realize they can make a great impact on the lives of their employees, their friends. Just again, by just reaching out to the Alzheimer's Association, start a team. If you can't do a sponsorship, but get involved, find out how you can help.
Grace, you touched on this, and one of the things we hear about in this day and age, as far as nonprofits and public service groups and everything else, is you can't get young people involved. That they're too busy and they're not interested. But that's not the case with this walk, is it?
No, I can speak to that. I'll speak on behalf of Sean Baker. He's a junior high school, Long Meadow High School. He actually reached out to me from his, he's going through with his family, like Grace alluded to, with his grandmother, really kind of inspired him to reach out and be a part of the committee. He's literally taken it upon himself to organize a purple theme day at his high school. He's actually has his own landscaping company in which he's going to donate the funds back to the Alzheimer's Association. He's getting ready to start a team amongst his class and have his own club part of that. So, for me, it's just one of those things that it really impacts every day. I think it's just a matter of spreading the word, people mentioning it to everyone. And I've had a couple of high school kids and even college students reach out to me to want to be involved. I think it's out there. It's just a matter of, I think, the view that this is only for older folks, but no, this is actually impacting everyone, like Beth said, knows someone. It's their grandmother, it's their aunt, their uncle. So in my mind, I'm terribly proud of Sean. I mean, I would like to, if he was here today, obviously he could go a little bit more in depth, but for me, it's humbling when it's a high school student that wants to reach out and do this on his own. This was his idea. This is what he's going to do. I know he's going to be reaching out to fellow high school principals that see if they would like to join their own team. So I think that's one thing that's very inspiring. Come along before summer break hits, is perhaps we can have some high school teams join Walk, and hopefully maybe that's another way to spread the word amongst their school.
I've always been one who believes that community involvement should be part of the curriculum in many high schools. And for credit too, but I mean for Sean to do this on his own, it's remarkable. It makes me feel good about the next generation.
Absolutely, I feel the same way, and he's quite an entrepreneur, right? And I think I want to mention though, you said before, Dave, Alzheimer's isn't just older people. There are people, the youngest person that we know that's had Alzheimer's is 21 years old.
Oh my God.
But there are people that are involved in sports accidents, right, that have chronic traumatic encephalopathy, which are the football players, right? You get your head hit enough times, it's going to affect your brain. If you've ever seen that movie, Concussion, I think with Denzel Washington, it's certainly worth seeing. But there are a lot of younger people that are getting it. And that's pretty darn scary. Years ago, I think they called it hardening of the arteries. My great grandparents died of that, but what they really died was Alzheimer's. That wasn't called it then. But there are younger people getting it. There's early onset dementia. There's sports accidents. There's just a lot of things out there. And it affects all of us.
The other part of this too is that getting involved and seeing young people getting involved is that I know many people kind of wait until they're impacted by it. Well, it's hit my family now, I want to give something back. I always like to look at getting involved with like the Alzheimer's Association or any group like this. This is an insurance policy for you. that you have a place to go. When this impacts you, it's like, well, who's the first phone call I make? I need help. And the fact that the Alzheimer's Association is there, and with the toughness of raising money in this day and age, it's crucial that the money be raised. So to make sure that it is there.
Yeah, the pandemic may be here, but it doesn't stop Alzheimer's. And in fact, it has made it worse. So the money is needed more now than ever. So we hope that people will answer that call and be involved in one way or another, whether it's financial or just volunteering. But it does, it doesn't stop it. So we certainly hope people that are listening.
One thing I'd like to jump into as we're talking about answering that call is our 24/7 helpline. Being able to call that at any time, it's completely free, and it's in multiple languages as well. So really, it's one of those things that could really make that phone call. And for those seeing it, you can go online or whatnot, but it's 1-800-272-3900. So literally just call that anytime. Someone is going to be there to help you along the way. And usually that is a first step along the way. And one thing too, I might have to look down a few times, but we do a lot of things in Western Mass. Right now, we're still waiting on the 2020 facts and figures as far as what we have done. But I can say in a normal year, for example, 2019, in Western Mass, we had over 2,000 unique constituents served through our programs and our helplines. We had 13 unique support groups that had 88 meetings. And we had 11 early stage social engagement programs as well. So essentially, we are doing a lot in Western Mass, and that's something I think it needs to be celebrated. This is not just Massachusetts. This has happened locally at the community level. So I just want to make sure that's aware, folks. Call the helpline. There's multiple languages that you can be helped. We're doing this. We're on the ground. Our boots are going, and it's all because of Walk and Longest Day. It's all volunteers. It's our walkers.
All right, let's talk about that, because as we wind down, again, the Longest Day coming up and the Walk to End Alzheimer's. If folks want to get involved, again, how do they do that?
I think the first thing that they can do is, if they want to get involved in the walk, you can search alz.org /walk, and you'll be able to type in your zip code and find the walk that best suits you. And then if you want to get involved in the Longest Day, it's alz.org /the longest day. And you can get started and sign up right there. And Jacy and I will be here to help give you any resources you need, give you any materials, and help you along the way.
And the walk is on September 27th. Am I correct?
September 26th.
26th.
Oh, see, I'm not correct. The 26th at Holyoke.
That's my son's birthday, so I remember that. So.
Oh, okay. At Holyoke Community College. And if people are interested in being sponsors, being walkers, being whatever, certainly find us online or calling us. You can call the main number for the Alzheimer's.
If you have any questions, call in the walk. We're on the Pioneer Valley Walk. Feel free.
Right.
On the walk website. I have my contact information, but my number is 617-393-2152.
Well, Jacy and Aimei and Grace and Beth, thank you all. You're doing God's work, and for all you do, and for folks to get involved. And we hope you'll see everybody at either the Longest Day or the walk. Thank you all. My thanks to Beth Cardillo, Grace Hanson, Aimei Lund, and Jacy Settles for joining me for this week's edition of the Even Better Western Mass podcast. Now, for more information, you can visit the Alzheimer's Association's website. It's alz.org. That does it for this week's Even Better Western Mass podcast. Thanks for watching or listening. Stay safe, stay well, and if you can, join me next week.